Welcome to The Explainer. Today, we're diving into something pretty incredible: how artificial intelligence is being used to take on one of the world's deadliest diseases, lung cancer. We're going to look at a brand new platform that's trying to predict the absolute best treatment for a patient before they even start. So let's kick things off with a number that really puts this all into perspective: 1.8 million. That is how many people lose their lives every single year to non-small cell lung cancer. It's a truly staggering figure, and it just highlights why we so desperately need new, better ways to fight it. Which leads to the big question, right? With all the incredible medical advances we've made, why is this one type of cancer still such a tough opponent? Well, to get to the bottom of that, we've got to understand what we're actually up against. And it turns out, we're not dealing with just one single disease here. See, here's the thing: non-small cell lung cancer isn't a single entity. It's more like this incredibly complex web of genetic mutations and molecular signals that are completely unique to every single patient. The problem isn't just one broken part. It's the entire intricate system going haywire. Okay, so if the disease is this super complicated web, you've got to wonder, how are our current tools holding up? Well, unfortunately, it turns out they have some pretty major blind spots. Current analysis is a classic case of not seeing the forest for the trees. It tends to focus on just one or two genes at a time, completely missing the bigger picture, that dynamic interplay that's actually driving the cancer. The missing piece, what we really need, is the ability to see that whole forest, the entire molecular network, and to predict how it's going to react when we try to treat it. And these aren't just ideas on a slide. These blind spots cause real, critical problems. We're talking about tumors that suddenly become resistant to drugs that should have worked, or therapies with awful, toxic side effects. And maybe worst of all, those agonizing delays in finding a personalized treatment that can actually help someone. Okay, so we've laid out the problem. It's a huge one, but this is where things get really interesting. This is where a platform called K2 Vines comes into play. The platform is something called a theragnostic AI. Now, that's a bit of a mouthful, right? But it's actually pretty simple when you break it down. It combines therapeutics and diagnostics. The whole idea is to use AI to both diagnose the unique network of a tumor and, at the exact same time, predict which therapeutic drugs will work best, all before a single dose is ever given to the patient. This is a total game changer. It's about shifting from a reactive approach, let's try this and see what happens, to a predictive one. The goal is to decode the tumor's entire unique landscape and map out the best possible battle plan, right from day one. So, how does this thing actually work? Let's get into the nitty-gritty and see how the platform takes raw patient data and turns it into a potentially life-saving insight for a doctor. It all boils down to a really slick three-step process. First, a clinician uploads the patient's molecular profile, all that unique genetic data from their tumor. Second, the AI engine, which is called K2 Think, gets to work. It runs countless simulations, modeling these complex cellular pathways to predict how different drugs will work and to flag any risks. And finally, boom, the platform delivers clear, actionable recommendations right back to the doctor. And this is where it gets kind of sci-fi, but in the best way. It completely changes how a doctor interacts with all this complex data. Instead of sifting through pages of reports, an oncologist can literally just ask a question, in plain English, about a specific mutation like KRAS G12C, which is a really common driver in lung cancers. And check this out. The AI doesn't just spit back a bunch of numbers. It actually thinks. It synthesizes the information and gives a direct recommendation. Here, it's suggesting a combination of two different drugs is the most promising path forward. It's basically having a conversation with the data itself. So what does this all add up to? I mean, this is about way more than just a clever piece of code, right? This is about the fundamental real-world impact this could have on patients and on the entire field of cancer research. For starters, you've got the potential for much earlier diagnosis. By picking up on these complex molecular signals that might get missed otherwise, the AI could spot aggressive subtypes of lung cancer way sooner. And in cancer treatment, you know that timing is everything. Then there's the effectiveness of the treatment itself. This is huge. By predicting how a specific tumor is going to respond, you help doctors skip that whole trial and error phase and go straight to the most powerful therapy for that individual patient right from the jump. And the impact doesn't stop with just one patient. Think about the ripple effect this has on cancer research as a whole. Scientists can use this thing to virtually test out new ideas in a matter of seconds instead of months. It could just dramatically speed up the discovery of the next generation of treatments for everybody. And really, it all comes down to this idea from the team that built this technology. They say that at the intersection of data and biology, we don't just find insights, we find hope. And that leaves us with one last massive question. If an AI can learn to decode the incredibly complex network of lung cancer, could this predictive, personalized approach become the new standard for fighting all kinds of cancer? It really points to a future where treatment isn't a game of chance, but a matter of precise, data-driven design.